Good morning, everyone.
Good morning, Marilla. Awesome. Well, I show it as 9, so I'm gonna go ahead and get us started. As you see, I think we have a momentarily third grade is happening behind me, but then that will go away. So, not the third grade classroom I remember at all. No Jessica Nickerson sitting next to me, anyways. All right. Cool. So we'll go ahead and do welcome. As always on Zoom, we have a fair number of people on, so it looks like a bunch of awesome people I see over here on the roster list. We won't make everybody call themselves out, but I certainly do appreciate everyone who's here. I'm sure we'll have a few more pop in as we get started. We'll have, as always, the Stars team introduce themselves just for anybody who doesn't know us. So first of all, Hi, I'm Nick. I am running from my amazing remote location. Please don't be envious. And let the rest of the team introduce themselves.
Steve Laffey. I'm one of the ED attendings at Glennon and medical director for the program.
Hey, Trish is here. I'll turn on my camera in just a little bit. Thank you, everybody, for joining.
All right, Marilla.
Hi, I'm Marella. I joined STAR recently to help them with their data and application organization.
All right. Gina, you might as well get in on this.
Gina Pellerito, STARS, one of the STARS coordinators from St. Louis Children's. Is Sabina here?
I do not see her on the
Yep.
list. Oh,
Yeah, I'm here.
I lied. There she is.
Hi, I'm Sabina. I'm the other EMS outreach coordinator for Children's.
Cool. Awesome. All right. So, well, like I said, we have more and more people joining. So those are some of the main STARS players. I don't see Jeff on here yet, but obviously Jeff Siegler is also the medical director for the children's team over there. All right. I jumped my screen. So welcome and introductions. There we go. And so we did have some kudos to give out. There's been a lot of great things. I had to give some agencies some trouble because we had 2 amazing calls happen immediately after our last STARS meeting. So I want to make sure I get a shout out to those crews, and then just some other things that have been going on. And I'll let Trish kind of speak to this first one just a tiny bit more, but really there's been some awesome help down south as we try to get one of our really complex high-risk kiddos who lives, of course, in the middle of nowhere, the best way back to a tertiary center. So I didn't know if you want to expound on that, Trish.
They put me on the spot, man.
You're welcome.
No, lots of appreciation actually to CCPA and Perryville both. We a lot of STARS, a lot of issues that go on behind the scenes at STARS are quite frustrating especially when you get into very rural areas. And we discovered that one of our kids she didn't have much access to 911 at all. By technicality, CCPA was supposed to be her responding agency. They were on the very, very edge. They are on the very, very edge of Perry County, and we're looking at minimum a half an hour response with that ambulance being in quarters with a direct call to dispatch and not trying to battle 911. Still not positive that they have consistent actual 911 services. And then, so actually probably more like 40 minutes once you look at switching calls and everything from police agencies and such. No responding fire department as first responders. It's purely volunteer with no EMS capabilities. And as we looked at it more and more, while Perryville was not her responding ambulance, they were going to be significantly closer. So both agencies agreed to, kind of ignore jurisdictional lines and make her a Perryville response. She's been flagged at both dispatch centers. CCPA gave us a direct number to their dispatch center so that we have a plan now. Parents can call direct and they'll get both ambulances going at the same time, just in case one is out. Also worked with Perry County Memorial Hospital, who agreed to do some training on her since they are going to be her closest hospital. And Area Vac jumped in as well with reviews of her plan. So everybody kind of came together and decided to do what was in the best interest of the child, which was fantastic. And then we also convinced Complex Care that they should probably have oxygen and suction and SpO2 monitoring in the home. Not necessarily because she has a significant or expected, that she has an expected frequent need for it, but just for the fact that she stands, she's at such high risk for not, having any ALS intervention for quite a significant amount of time. So it's kind of interesting to put all these pieces together when you look at kids living in rural communities. So,
Definitely a good one. I'll probably bring you back in on the LCAD one too. So I'm not putting you on the spot. I'll give you a full slide to it.
yeah,
We did have a recent SCAD call, just another good example of direct to tertiary, kind of a high risk seizure kiddo, super complex, and one of those situations where, it just in the olden days, as I like to call them, it just would have been like, I don't know anything about this. Of course, I'm stopping at the closer facility, but just to see them able to manage the emergency and bring the kid all the way directly to their pediatric facility is really just such a help for the patient, as long as it can be done safely, and such a help for that family. It removes a lot of delays in care. And as we keep finding in more and more situations we've been discussing each and every week, the outside facilities, if they have to stabilize, you do what you have to get them there. But just so many of these things just require like a swift understanding of exactly what's going on. We just recently had this example come up in the heart kiddos and central shunts clotting off. And yes, like that's a kid who's going to be at death's door, but the idea that the outside facility, that's so tough for them to pick up on. It's not something they deal with and they're going to know immediately what to do with. And so even though sometimes these kids present the sickest, if you can manage the basics and manage them with some critical care and get them to their tertiary, you really will give them their best chance. So just another good example of that. A huge shout out to St. Louis Fire Department and Merrimack. They both had recent G-tube saves. In both cases, the original G-tube couldn't be replaced, but both crews were able to place a placeholder with a suction catheter. This is a picture from the actual city call right here. That was a good one. For full disclosure, the Merrimack call wasn't actually even a STARS kid. They certainly will qualify. It was a Mercy grad though that the crew ran, and they said it was just so awesome that they knew what to do. They felt really a lot more comfortable with placing a catheter and maintaining that G-tube, especially since they have longer transport times there. Both with the G-tube calls and the RTAD call, I'm gonna not go into too much detail because we're doing it in the call review that we did in December, and we're gonna repeat again in February. So for those of you who missed it, I think it went well, and you should totally chime in because we got a lot more detail from the trip sheets and the calls. But the RTAD call was just another, it was an outstanding example of just a way to do a refusal on a call that previously would have transported as a kid who was actively seizing when they got there. They treated with fairly heavy doses. They got med control involved early though. And ultimately the family outcome, what they wanted was to not be transported. And through, a lot of good communication, they were able to do that. And then of course, a huge shout out to their deputy chief who went out and actually picked up a prescription for the family so that we could safely leave them there. That's actually an enormous deal. I don't even know how to make such a big deal out of that. That's awesome. I think we briefly discussed the Flow Valley call at the last meeting, but just, more follow up from that was that, the family was super pleased. This is a kid where they're one of the toughest STARS starts you'll ever see. We're talking trach, the kid's got a VP shunt. They got all kinds of pathology falling on neuro side of the house, respiratory side of the house. But with knowledge of that kid and good understanding and sort of talking to the family, they were able to safely get a refusal. Family just wanted some reassurance and had nothing but glowing things to say about the crew afterwards. And so there was a good comfort level with that call. And then unfortunately, we did also have a code out in Lincoln County with one of our kids, and as awful as those situations are, we do always look, did we get the best possible outcome of the situation that we could? And I didn't know if you wanted to discuss that case briefly at all, Trish.
I certainly can. If you did you say you have a slide just for it, or?
Oh, I'm sorry, I do not for that one.
Oh, okay.
I was just going to
Um,
kind of lay out the bit of the scenario and just, how
Yeah.
it went for the cruise.
No, absolutely. Start my video here, sorry. Hey, at home with dogs, kids, and cats in the background, so I apologize if there are interruptions. So this is something that, it's a sensitive subject for a lot of people. Pediatric death is always difficult to talk about in general. And working a pediatric code and calling it in the home is currently just not the norm. But however, when it comes to our very ill STARS patients, especially those who may be on a palliative or hospice track, that may be the most appropriate thing to do, especially when you're at a significant distance as LCAD is. Dr. Laffey and I have discussed the benefit of sometimes getting these kids to their hospital when there are appropriate support services for parents and the people who are trained in specifically in pediatric end of life and actually know that child and know that family. But when you are talking about a distance and you have a child that's very, very ill with a known poor prognosis, I think that this was a very appropriate thing to do. They worked the cardiac arrest at the parent's request for the 20 minutes as they would for an adult, and then allowed parents to be a part of the decision-making when it came to actually calling the arrest. They called medical control appropriately, but as I mentioned, also let parents, kind of feel like they had some control over that decision as well. It was a futile type arrest. She had a significant downtime. But then, what that did was allow the family to hold her. Wings was able to make it out to the home and help as well. Our footprints department did reach out to the family, and I was able to provide some information back to them actually, and give them some more information about how mom was suffering emotionally via talking to EMS. So again, it's just connections that we didn't have prior to STARS that we have now that I think are making quite a difference. And I don't want to say I'd like to see this happen more often, because of course we don't want to see this happen more often, but in these cases, it would be, I think, a benefit to families and everyone if it could be more normalized in the future. Steve, did you have anything you wanted to add to that? I don't know.
I was just super impressed. I thought it was great. The comfort level was there, which is obviously the hugest thing. So yeah, I think it went really well. It's a really tough call. And there's some discussion out there about how often this kind of thing should happen and not transporting those kind of things. And that's a really tough one, but under the right circumstances, I think it can be a wonderful thing. And I think that this is one of those circumstances. So I was super, super impressed.
Yeah, and Tim Rusterberg asked, what is Wings and Footprints? And I apologize, we sometimes throw around these names as if everybody is aware. Footprints is our palliative program at Cardinal Glennon. So they work with not only just our palliative track kids, but any kids that really have a poor prognosis, family members who are under a lot of stress. They provide spiritual, financial, emotional support at the bedside. And then Wings is a hospice program for pediatric patients that's run out of St. Louis Children's. So they don't just follow St. Louis Children's patients. However, they are a hospice program for all pediatric patients within their area. So thanks for asking. But yeah, as Dr. Laffey said, the comfort was there. This crew actually had worked with the family through one of their other children who had passed away, and they knew them very well. So that made, I think, a really big difference in the call.
Like you said, hard things to talk about, but maybe some positive steps we're making into a really hard realm as time goes on here. I did also want to throw a kudos out to the dispatching agencies, obviously for all their work with us to dispatch any of the calls. But I'll point out on over half of these calls that we're giving kudos on, the crews had the plans on the way to the call. And that, like I say, there's different ways to access the information, but we still think that that is the best and the easiest to work with. We think it helps us achieve that best outcome. So just a kudos to all the dispatching agencies who are still working with us to make that more and more a reality in the norm. On that note, I did want to give, we clearly, as we analyze our data from 2020, we're going to have some stellar awards to give out. But I did need to toss, got this report from IIT last week, and I was sort of blown away by the numbers as Collinsville Dispatch and then their fire department also regularly log in to the program each and every day.
Me?
They beat you. I'm sorry. I put the top 10 list. I mean, I'm gonna have to watch out.
But come on.
So yeah, I mean, for full, to the other names around them are, obviously I don't count, but that's my IT leader, and then there's Trish, and then our 2 Slitch representatives who got on a little bit late. It's a whole new year, guys. It's a new competition. Let's take it to the max. Except Gina, I'm gonna beat you, Gina. But other than that,
Ow, way to call me out again.
no, hey, you didn't have
No,
access.
Hey,
earlier.
Trish,
Yeah,
Trish, did you want to, I think I just saw another chat pop up.
I am. I'm answering it here.
Okay, cool.
Cool.
I'll let everybody know just in case everyone else can't see the screen. So Megan Black from Granite City, correct? Who's fantastic. Can EMS have wings or footprints come to the scene if they are working a code, or be transported? I think I get what you're saying now. So Footprints does not operate outside of our hospital. They can make phone calls, of course, and talk to parents and coach parents and help with funeral planning, et cetera, and emotional support via phone. Unfortunately, I wish they could come out into the field. They probably wish they could come out into the field. Wings can definitely be called out to a home because that's an actual hospice program if the child is already enrolled. So if that is a child who is enrolled in the Wings program and we have them in STARS, I always make a habit of putting the contact number on there so the EMS can contact them, because Dr. Laffey can contradict me if he doesn't feel it's appropriate to say, but I think sometimes they might be able to give more guidance than even if you call our hospital or Children's, because they know the family so well. And they are planning for this process.
Completely agree.
So
Yeah.
they, and I hate to speak for them, but I can't imagine a time when at end of life, they wouldn't come to the home, because that's what they're
That's
doing.
what they do, right?
Yeah.
Cool.
And it's one of those situations where the family, under stress, that's the plan, is that when these kind of things start happening there, that's the whole point, is to call them, right? I mean, that's kind of that's how it's supposed to work. But again, sometimes under these stressful situations, that's why the contact information is on the form. So, to them as well. But yeah, you will talk to somebody what's going on there. That's the nice thing about it.
Yeah. And then I try to, if people are interested, I want to do a parent's perspective lecture I've been trying to do for a long time, but something else I want to do is a death and dying lecture for EMS that we will get done eventually, but we'll talk about these issues specifically, I think. So I think that's good.
Cool. Mr. Tim, just to go back, he was asking what this list is, and I guess I should explain that. So this is a unique login for each day. And the answer, Mr. Tim, is actually right now, as of yes, you can be logged in for 24 hours. We do anticipate that being drawn back to 12 at some point. But as of right now, once you log in for the day you're in. And so what this represents is, obviously we switched over to a new system in the spring of last year. But for instance, Collinsville Dispatch, they were logged in 31 days, August, 30 September, 31 in October. They logged in 25 in November and 29 in December. So it just represents the fact that that user logged in at some point on a day in that month, and that's all this list tracks is just how often people are logging in. So and dispatch certainly part of the reason that it has that longer time window to be available to you was with the express interest of our dispatch agencies being able to start it for a shift, or EMS for that matter, and just let it run in the background just to speed up that time to dispatch should a call come in. So I hope that answered your question, Mr. Tim. All right. Cool. No, hey, no worries. This is all learning. Like I said, that's part of why we have these meetings, just so we can explain how it works, what works, what we've changed to make it work better. So yeah, these are all just meant to learn from. So just basic numbers as of last night. So we do have 658 live plans in the system currently. You can see the other numbers. I like how we've made there was a decision group meeting never to use the word rejected, and then somehow it made it onto this chart. So I think we'll keep it there for posterity's sake. Those plans are deferred. Okay. That's when a medical director says that he would like the plan, something changed in the plan and kicked it to the writers. So we did have a lead change in the number of affiliated stars. So Melville actually currently has the most stars. So you guys can work on that. Congrats, Melville. Still a reward. These are dispatches by month for 2020. So we do acknowledge, especially some of these are test cases, but we have seen, kind of a steady number, and obviously what we'll look for this year is just to see growth in that as we add more and more kids into the system and kind of get more and more adoption throughout the EMS community in the region. As always, dispatches do not always tell the whole story. Just, we have some areas that are more rural, or for whatever reason, the family doesn't tell dispatch. There's no way they can send it. But if we have had crews recently arriving on scene and still being able to look up the kid, which is a huge win. That was something we were always striving for. And so we do also track the number of times crews hit that emergency activation anytime they're on a call. And of course, we see a trend upwards, which I consider positive and I hope to see for a while. Well, obviously, I would prefer there never to be any calls, but I think the calls are going to happen anyway. So I would like to see, the crews able to use the system to get the good information. As we mentioned last time, especially for my dispatch agencies, I am starting to add on a couple of the calls, just some notes for you in the cautionary notes section. The main two we have devised so far is just a trach reminder. Just if you get to the end of your call algorithm and you're like sitting there listening to a family panic and you need something else, you want something to try and help them with. We have some extra info there, like, hey, just see if you can prompt them, see if you can remind them what they're supposed to do as a family unit in this situation. So trachs and emergency medicine administration. So if that kid is prescribed a home emergency dose that the family is supposed to have there, we'll include that info just in case they're in a complete panic. They're human beings like you or me. Their heart rate hits 160, their animal brain separates from their cognitive brain, and they just forget what to do. Just if you can prompt them to come back in and follow that emergency plan that they're supposed to have at home as well. So kind of expect as we kind of get more and more advanced or elaborate with that system, we'll try to offer more help to our dispatch side of the house as well. So I was going to offer too, especially I know I have a bunch of coordinators who attend these meetings. If there's ever any information that you want, I can't promise we have it in a canned report ready to go, but it does help me to know what would make your jobs easier. And so I do have an easy report for each of your agencies to kind of show you your people the last time they logged in, if that would be helpful. But please always let me know if there's some other information that makes it easier for your job from your perspective. We have been working on our SharePoint resources, which is, for those of you who regularly log into the STARS application, is just one of the tabs at the top. We've been adding more and more info there, so please feel free to explore every now and then, including these monthly meetings. So if you ever lose the invite or you have somebody else who wants to come in, I do keep all the meeting invites, and then I've been putting our online webinar trainings on there. So you just, if your providers are looking for some education, we'll keep a running list of at least the big webinars we'll be doing so they can come in and get some free CEUs and come train with us. And then there's always some links down here, which I always play with. I've changed even again this morning, but including previous STARS meetings, if you ever need that. If you ever have to miss one, I get it. We're all busy people. You guys are working today too. You might go on calls. We do record each of these meetings. It usually takes me a couple days to edit this down and get it uploaded under our YouTube, but you can always catch up on what you missed if you need to. So, and including one thing we have added to our SharePoint that is a goal for us this year is when your crews are running calls, we really want to try and just capture a little bit of information afterwards. I promise we try to keep this as short as possible because I know the last thing EMS wants to do is fill out a 40-page questionnaire after they just ran a call and filled out their PCR. But just some basic information to kind of help us follow up on the calls and then to kind of track how we're doing and how we can be better. So just if you hear of any STARS calls going out, if you could have somebody, just go with one of the crew members, whoever texted, pop in, just fill out this brief survey. I think it should take them less than a minute. There will be, I know I can promise at least in our EMS room at Glennon, we'll have the link up. I'm sure I can convince Children's to do the same. Just as a brief reminder after you're out of the call, you can look it up and just go follow the survey, fill it out for us, please. And I wanted to didn't want you to think that we're like doing that for no reason. We clearly are trying to track some metrics and track the data of what we're doing with STARS and just to get the better outcomes for the kids. And so these are some of the things we're really looking into and following for this year. So like I said, we need those stories back so we can prove that, this is going better and that we're making a difference here. And then certainly what we can do to make it easier for you guys in the future and make it better for you guys and the patients in the future. I did have a brief homework assignment. This is not mandatory. This is optional, I think. I think all homework is currently optional in the world as far as I can tell. And so just for any of my EMS agencies, I know some of you have like a treatment or something in your PCR program to designate when a STARS call is happening, or for your crew members to list as an intervention or something like that. I was just going to see if I could get some screen caps of that, just to, part of the point of these meetings is to share ideas amongst us. And some of you have the same programs that another agency has, so we can say, oh, hey, everybody who's on Zoll or whatever reporting software you have, you can do the same thing in your setup. So one new thing, Trish and I, for better or worse, we do have a specific STARS phone now, so you don't have to call our personals all the time. We kind of share it almost like on call, so I was just going to share that phone number with everyone. The idea, one of us will always have this with us. We'll try to answer as best we can or get back to you as quickly as possible. But the idea that, anytime you guys are having an issue with either a call, the application, anything, we want you to be able to have a way to reach us quickly. So, and I was just going to give a real brief application update. We kind of have a lot of improvements coming in the background. The main one that will affect the end users, you guys, as you go on the calls, is we're working also on fixing up the dashboard, which, as you all recall, is what you log into and look at. We're trying to forever and always make that simpler so that it flows better for emergencies. And right now it's just a little bit clunky. Like, it's great if the kid's on your main dashboard, but then it's a little challenging if they aren't, and it's not always clear what you're looking at. So just I wanted to give you some preface or some warning that will be changing later this quarter as we come up with kind of a better way to dive through the calls. That is a great question, Joshua. No, we won't be sharing that with parents, so. All right, Gina, I'll give you half a Stellar Award for that. All right. And then just some training opportunities coming up. We'll be having some online webinars. Gina and I are going to redo the call review we did in December. So for those of you who already attended, awesome. Please don't. This isn't anything new. You can come watch it again if you want. I thought we did an okay job. But if you liked it, please share it with your friends, and for anybody else who would like to come see. I think we went over 5 different STARS calls there on that review. And then we have some of our other courses will be available. And then classroom wise, we will be out and about a little bit, as always, with some caution, but as long as it's safe with your agency and we're fine, all wearing masks and being prepared, we will be getting out. Especially for my more rural agencies, I do kind of have a model that's going to work with Cox Health EMS. They have about 300 providers who need quarterly training. And so what we're going to do is we're going to record one, but then I'm going to be available online. They'll have their crews watch the recording, and then I'll be available for Q&A. So we're always flexible on different training options, whatever it takes to get this information out there in the world. And so I will gladly work with your agency. Mr. Corey, I think that is a 9 o'clock start on that one. We do the links to register for the webinars are available there in the STARS application on that events page. If you just click that Zoom link, it'll take you to the registration. Cool. Awesome. So just a couple other things going on there. And so, I mean, 2 meetings in a row, I pulled this train in at 9:30. So first of all, I'll take a stellar award for that. Were there any questions? We've had some really good questions up here today. Anything else on anybody's mind? Anything we can help with?
Nick, can you hear me?
I can.
Quick question. I want to, first of all, apologize for us. I didn't realize that we were not remaining logged in. What a delay that will be if we get a STARS patient and we're not logged in to send the information out. A reminder will go out to the floor today to remain logged in. Will they get bumped out? I mean, should I just make it every morning at shift change log in, or?
So that would actually work. What it will do is just if you've timed out, it will, and you click on the browser window, it will take you back to the login screen if they've timed out.
The other thing I wanted to ask you, I guess, and it's kind of did we miss any? I know Trish has backed us up and Christian's backed us up. I don't get notifications when we do the activation, so I don't know if we've missed any. Have you heard, or is Christian still doing most of them?
I know Christian caught one recently. I
can tell you from a Christian perspective, I don't know if Katie's on here, but I get notified when Christian goes out, and a lot of times I get 3 or 4 notifications, because if I catch it on the CAD, then I'll dispatch it, you guys dispatch it, Christian will dispatch it, and then a lot of times Nick or Trish will dispatch it. So sometimes we get 4 notifications that one kid went out. So I think you guys are catching it and they're catching it.
All right, cool. I mean, I'd rather have overkill. I mean, if
Same. I can't think of any lately that.
Well, and especially with the small numbers we're dealing with right now, Mr. Tim, if you want, like I can work with you on the side just to do like screen caps or something like that, and I'll just notify you when they're going out, and that way we can just kind of QI it and make sure we're catching the calls and see what we need to do to improve, or if we need to.
Perfect. Okay. Thank you.
Yep. Thank you.
Hey, Nick, it's Corey from Edwardsville Fire.
Hey, how's it going, Corey?
Hey, I just wanted to catch up with you, and I apologize. I've been missing the last few of these meetings, but last year at some point in time, and this is going to fall to me because I haven't been keeping up, but we had all of our, in Madison County anyway, all the STARS kids for the entire county. I had gotten a list of those, and we put those into the 2 separate CAD systems. So whenever we had any type of a call at either one of those houses or any of the homes, as soon as they validated the address, it popped up an alert and said, this is a STARS child, and it would notify the EMS agencies that were responding. So I haven't been keeping up with that. Excuse me. I know I probably need to get that list updated. But is there a way, first, I think you were the last one I had talked to about getting all this stuff updated. Can I get with you maybe sometime the rest of the week, or sometime this week, and get things moving forward to get us logged back in the way we're supposed to be, get our dispatch some information to, and get those kids back updated? Or
yeah, absolutely. I tell you, I'll follow up with you all offline about that, and we'll get you guys up, and both, if that's the way you'd like to set up, we are working on a slight tweak coming up here in February that will allow us to track the kids by county a little bit better. So especially for any agencies who still want to flag, that will be maybe a little bit easier to just be able to, I'll be able to present you a ready list of what kids are in what county, and if that would really help with the flagging process for those who still want to do that.
Yeah, I think that would be ideal because what we did is we took that list from you guys and we put them in. Excuse me. We had 2 representatives from each CAD, and I still have contact with them. But that way, Edwardsville gets a call in Collinsville. It's not in our system, but since it's in our general or our shared CAD, if we're making a mutual aid run, it's still going to show up that that's a STARS kid based on the address alone, and then we can log into it. So just the notification en route that we know, and that's why we did it on a countywide basis.
Okay, cool. Yeah, I will. I tell you what, I'll follow up with you offline about that. I appreciate you bringing that up.
Outstanding. Thank you.
Mr. Torno, that is a long-term dream. I cannot say that is going to be imminently available, but I do have the referrals online. I know it'll take just a little bit of legwork, or if there's a way to, if you can get the contact info to us, even just the parents' info from the trip sheet for somebody you would like to refer, we can follow up. Obviously, it's a little slower. It's not always ideal. But we certainly don't want to leave you guys, any kids hanging out there and your crews hanging either. So cool. All right. Any other questions for me this morning?
Nick, did you want to address the county issue and what we are correcting? I'm not sure how many Illinois people we have on here, but I think that's the most affected just because of the incident we had.
Yeah, I can address that real quick here.
Just a quick reminder.
So the challenge that we run into, and it rarely affects the Missouri side of the river just because of the way our districts are laid out at a county or smaller basis. But whenever you see a badge on a kid, obviously this is their primary EMS district that they live in, their state and their county. Unfortunately, currently the state and the county are pulled from the EMS provider instead of the kid's form. So the challenge we run into is, for instance, my Illinois STARS, I have to pick one state and one county for their agency, but that's not always where the kid lives. And so we did recently have a crew who thought they had the wrong number. The parent, they looked up the kid, but they're like, well, that can't be this kid because it says this kid lives in Randolph County. Well, no, and the kid actually lived in St. Clair. It was just a mistake on the front of the badge. We are working on tweaking and fixing that, so that problem should go away very shortly. But just especially for my Illinois people, if don't be dependent on this county tag that might not be accurate specific to that kid until we can get that resolved coming up here in February.
I don't think it affects I don't think we have any other areas that really affects other than Illinois. I can't.
Yeah, I can't think. There's a couple areas in Missouri that would, as we spread there, but we're talking like western side of the state. So
Hopefully fixed by then. Yeah.
Yeah, Cox Health EMS and Mercy EMS would both get caught under that same thing.
Yeah, true.
Any agency who covers multiple counties will deal with that issue. Cool.
Thank you.
Awesome. Well, thank you guys so much for your time today. I'm always open to feedback. If there's anything I can do that is more useful to you on these meetings, please let me know. And other than that, I hope everybody stays safe and has a good day.
Have a good day, everybody. Stay well.
Thanks, Nick.
Thanks. Bye, everybody.
Yes, thank you.
Thanks. I'm sorry. It was my family's first day on Zoom. We're getting there. I promise.
That's okay. Our office is under construction, by the way, everyone. So we'll be back in our professional setting soon. Bye.